On my right, let me introduce who I have with me, and then acknowledge some special friends. To my right is Gareth Rhodes, who is the State Budget Director. He doesn't smile much nowadays because the state budget is not in great shape. But when the federal government does the right thing and gives us funding, we expect that he's going to smile, that big smile again. It's a pleasure to be in Rochester with so many of my friends who have done such great work for the state. Former Lieutenant Governor Bob Duffy, who worked with me when we first got started and has done great work for the entire state of New York. Danny Wegman, pleasure to be with you. Wegmans is a great New York corporation, everything you've done. And Nicole Wegman, thank you. Pleasure. Thank you for being on our New York Forward Advisory Board to help us going forward and find our way through this. Let's give you an update on where we are today. The total number of hospitalizations is down. You see that curve coming down. You see that mountain that we went up. Now we're on the other side of the mountain. You start to see the shape of the mountain. Unfortunately, the decline from the mountain is not as steep as the incline, right? And the big question for us in New York and every state across the nation has been how fast and how low does that decline go, right? How fast does the decline actually happen? And what is the lowest level that the decline will reach? Unfortunately, you see that we were hoping for a quick up plateau at the top, which is what they talked about, but a fast decline. You see the decline is again, not as steep as the incline. But it is a decline, and that's good news. The net change in total hospitalizations is down. Is good news. And then the other end is how many new cases are coming in the door every day, how many new diagnoses in COVID cases. And that number is also declining. So not only are the number of people in hospitals coming down, but the number of new cases coming in the door is down. And that's good news because it had plateaued at about 900 statewide for a few days. But this number is down at 700, and that's a good number. I would take this with a grain. Is just been put in place. This never happened before. This is now every hospital in the state reporting every day for the first time. So it's a plus or minus across the board. This is the number that haunts me every day, and this number is not declining anywhere nearly as fast as we would like to see it decline. Still 226 New Yorkers who passed away. And so we don't become immune. We talk about these numbers. It's 226 families, right? That's 200 should be talking about. This is not a sustainable situation. Close down everything, close down the economy, lock yourself in the home. You can do it for a short period of time, but you can't do it forever. But reopening is more difficult than the close down. The close down was relatively simple, right? You go into the basement, you throw the big power switch, and everything just goes down. Close the businesses, stay at home. It was a blunt operation, and one that was done all across the country. Just stop everything now. When you go to restart the reopening, now this experience, and second, let's be smart about what we do. And I get the emotion, and I get the impatience, and I get the anxiety. We all feel it. When I say the situation is unsustainable, it's unsustainable on many levels. It's unsustainable economically. It's unsustainable personally. A lot of anxiety is now all through our community. We see it in increased. One of the lessons is we have never been here before, and we didn't really know what was going on. CDC releases a report end of last week that says the virus was actually coming to the East Coast from Europe. Everybody was looking at China for all those months. China, 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 China. Yeah, China was last November, December. The virus migrated from China while we were all staring at China and went to Europe. Planes from China. Yeah, but meanwhile, the people from Europe were walking right past them. And that's where the strain came from that was infecting this area. And that's what the CDC just learned last week. And this is going back to February, right, on one of the most studied topics ever. Again, just learn the lesson. Of what happened. You now add that piece of information on the Europe trips, and then you see, because yes, the flights were landing here, people were coming from Italy and UK and from European countries, and nobody thought to screen them, nobody was on guard. And you add that to the density of New York, especially in New York City, and that virus just took off. Okay. We didn't know. We didn't know. Now we do. We also can look back in history. You look at that 1918 flu pandemic that they talk about. The places that opened too soon saw that flu come right back. And by the way, that flu was not one wave. Right? We're not the first one down the chute. There were other countries that went down before us. You see, they wanted to reopen also. They were feeling the pressure on reopening. And you study those cases, and you see that you reopen too soon, or you reopen unintelligently, and you can then have an immediate backlash. And that's not speculation. That through this in different iterations, he was one of the pioneers on the HIV virus and AIDS. And he says, we could be in for a bad fall and a bad winter. Could be. Why? Because he doesn't know, he's not sure, but could be for a bad fall or bad winter. Okay, so put all of this in the in the equation. And then also acknowledge and actualize that the truth is that nobody knows what happens next and when it happens. Well, how can that be, that nobody knows? We're so sophisticated. We have so much intelligence. We have so many experts. This is the United States of America. How experts, we look to experts and we expect them to know, so we push them to know. Answer the question, tell me when, what's going to happen in September, what's going to happen in December. Sometimes the answer is, I don't know. Sometimes that's the honest answer. I was talking to my times, I say, I don't know. Why? Because I don't know. And if you don't know, say you don't know. And I speak again to the best minds in this country, the best minds around the globe, and they don't know. So if you don't know, say you don't know. It doesn't mean you're not smart, no reason to get defensive. I don't know. When you know what you don't know and admit it, it will care for different possibilities. And that's where we are. We don't know, but we will be prepared for all possibilities. So, reopening, chart a course, because I feel this, I feel that, because someone said, well, other states are opening, so you must be able to open if other states are open. Forget the anecdotal, forget the atmospheric, forget the environmental, forget the emotional. Look at the data, look at the measurements, look at the science, follow the facts. And that's what we've done here from day one. This is no gut instinct. This is look at the data, look at the science, look at the metrics. Move forward. So let's do this intelligently based on metrics, and we'll see what happens. And we'll adjust to whatever happens. Well, what does that mean on metrics? You can measure this.